Hey guys, what's up? Welcome back to my channel. My name's Taylor. I have cystic fibrosis, and today I'm going to be doing the lame lung tag. This was a tag that circulated in the CF community a lot, like 2015, 2016, but it's kind of been on my list of like short, easy videos to film, and that is what I needed this week. If you didn't notice, I am in a very different place. This is my dorm room. I'm at college now, and today we started classes. I'm a little busy, got a lot going on. But I really wanted to get a video up. I really wanted to post this week. Figured I could shoot this video really quickly. It's just 5 questions. I guess it's kind of based on questions that were commonly asked as CF patients. Also, if you've seen this, my lovely purple tattoo, I got it at an event here on campus called First Night. It was a big like party the day that everybody moved in, so my floor went together and we all got matching tattoos. So it'll go away in like a week, but it's very noticeable at this point. And yeah, without further ado, let's get to the questions. So the first question is, how do you keep track of your meds and treatments? So I wish I had a better answer for this question than I do. I've never really had much of a system for keeping track of my meds, which is probably why I forget them a bit, but I remember to do my vest because it's been a part of my daily life for as long as I can remember. And then I put my vitamins and most of my like morning and night medications, I just put them right next to where my treatment stuff is, so that when I sit down to do that, I see them and I take them. Enzymes, I remember, actually I don't remember very well. I'm getting back into remembering them more, which is good. I'm getting better at it, but that's kind of hard to remind yourself to do because you just have to do it right before you eat. So there's really no, like, you can't set an alarm to remind yourself of that. But I would say, like, if I do get like new medications or if I'm on an antibiotic that I have to take like every 12 hours or something, I tend to just set reminders on my phone and do it that way. As far as keeping track of like my actual medications and like keeping track of my health, I have this just like accordion folder here that I have a bunch of reference material in that they give me at clinic, like order of treatments and information on drugs. It also, at my clinic at the end of the visit, you get a paper that has like your PFT information on it and your weight and everything. And so I keep all of those papers in here so I can sort of keep track of that and look at it if I ever need it. It also gives you a printout with all of your medications, so if anything changes, if doses change, I can refer back to stuff in the binder, like refer back to my last visit in the binder to see what I really need to do. But other than that, I really don't have much of a system for keeping track of my stuff, which is embarrassing to say, but is true. So, sorry. Question number 2 is, what is your personal baseline? Since I'm 18 right now, and so I haven't been really keeping up with my care and my numbers for very long. So I'm not super familiar with my baseline, but I'm pretty sure it's around 90 right now. It's a really good baseline to have. It has gone down in the past few years. It used to be upper 90s and now it's down to, 91, 92, but it's still a very good, a very usable number for a CF patient, so I'm happy with that. What do you do for airway clearance? The short answer for this is I do my vest. I do the vest twice a day for 30 minutes. I also use the aerobica a lot. Sometimes I use this to supplement my vest. I'll do like 10 or so breaths in this kind of throughout the day if I'm feeling junky, just to help clear my lungs a little more often than doing the vest all the time, and a little bit easier. But also sometimes, not very often, if I'm traveling for a weekend, I will use this to replace my vest because it's smaller and easier to travel with. If I am like replacing my vest with the aerobica, I'll do like 10 breaths, like 5 or so rounds, I guess, and cough as much as I can in between those. Yeah, for the most part, that's it. I've used a flutter before, I've used an acapella before, but I like the aerobica better, and I really prefer to do my best. Okay, question number 4 is, what is your least favorite type of cough? And I don't think this, I mean, it's not a cough, but my least favorite thing about having CF is the fact that I have to clear my throat all the time. Like if I'm sitting in class and I get called on and I don't clear my throat before I talk, I sound like a smoker. So I have to like really clear my throat before I start talking, and it's annoying to just be doing that all the time. That's not really a cough though, but it's close to a cough. But my least favorite actual cough is the short, shallow, dry cough. Like you have to cough. You know you have to cough. Clearing your throat's not working. You have to actually cough. But it doesn't accomplish anything. You don't feel it in your chest. You feel it in your throat. And oftentimes, because it's so dry, it leads to a coughing fit because it didn't do what it needed to do, and it tickled your throat, and now you're coughing for 5 minutes, and it's really, really frustrating. And a lot of times clearing your throat kind of leads to that cough, and so it's like you do it in public a lot, and oh, it's the worst because it gets nothing done, and it's super annoying. Okay, the 5th and final question is, what other organs are impacted by your CF and how? I'm very lucky in that I don't have a list of diagnoses related to my CF. I have digestive issues, so that's mostly in the pancreas. I also have some blood sugar problems, so that's the pancreas. Other than that, right now I'm really lucky and healthy. I don't have a lot of problems with my liver or a lot of problems with anything else at the moment. It's just mostly the lungs and the pancreas for me at this point in my life, which is good because those are manageable. That is a very manageable amount of stuff to have going on. Alright, that is all 5 of the lame lung tag questions. I know this has been sort of a short video, but I have been really busy this week, and I know I'm going to be really busy the rest of the week, and this is really all that I had time to film and edit this week. But in the future, you can look forward to some great videos like a dorm tour. If you're wondering what my CF enabled dorm looks like, I'm living in a single dorm with a private bathroom, so that's a little bit interesting. I will be filming a dorm tour soon. I plan on doing some videos on spoon theory. If you've never heard of spoon theory, it has to do with all chronic illnesses. I plan on getting that done soon. I'm gonna take you to clinic in a few weeks. We're gonna have a good time, but hopefully I'll have more time to film in the coming weeks than I have this weekend. I have just been swamped because my school does this thing at the beginning of the year that's called Weeks of Welcome, and so once everybody moves in, it's like event after event after event, and you also have classes and you also have homework, and it's just a little crazy around here right now. But I really did want to upload this week, and I'm really going to try to upload again next week, and I'm doing my best. I'm doing my best. But if you liked this video, give it a thumbs up. If you want more CF, you want more information about CF, if you want to learn more about what it's like to live with CF, especially on a college campus, check out my channel, hit the subscribe button. I try to upload every week. And yeah. Thanks for watching. Have a great day. Hey guys, what's up? Welcome back to my channel. My name's Taylor. I have cystic fibrosis, and today I want to talk about what exactly that means. Now, I know that I've talked about different aspects of CF in my past videos, but I've never really talked about CF as a whole. And in preparation for this video, I watched several other videos made by CFers explaining what it is.